Hi everyone, my name is Angelo Wijaya and I'm a member of UNFPA Indonesia Youth Advisory Panel for 2019-2021. Today I'm going to be sharing to you essential information on COVID-19 as part of UNFPA's campaign Youth Against COVID-19. The source of the information that I'm going to be sharing to you is the WHO or the World Health Organization. I recommend you to give it a check by yourself, to visit their website, or check essential information provided by local government or authorities. I am recording this video in the middle of April, and as the case of this pandemic is continuously evolving, I recommend you to keep updated on the issue as some information might be changed in the future. So, first off, what is COVID 19? COVID 19 is an infectious disease caused by a novel coronavirus. It's a new virus, so we don't know yet how much, a lot about it. But we're trying to learn as much as possible as fast as we can. Scientists all over the world are working hard to test and develop medication and a vaccine. The COVID 19 outbreak began in December 2019 and has now spread across the globe. As of today, more than 2 million people have been infected by the pandemic. So, the symptoms of COVID 19. The most common symptoms of COVID 19 are fever, tiredness, and dry cough. Some people don't have any symptoms at all. Some experience mild cold like symptoms, but some get very ill and can experience severe symptoms such as difficulty in breathing. Many people might not show these symptoms right away or at all, but they're still able to infect others without realizing it. This is why everyone must take the proper precaution. So, how does the virus spread? There are several ways the virus can spread. And this new coronavirus spreads very easily from people to people. Through droplets, the virus is spread when a person breathes. The droplet that infected people release into the air by speaking, coughing, eating, sneezing, or blowing their nose. Another way of transmission is touching surfaces. You can get infected if you touch someone that is infected or something with a virus on it, and then touch your eyes, nose, or mouth. This means our hands can become the vehicle for the virus to enter our body. The virus can survive on different surfaces for different amounts of time. For example, on paper for about 24 hours, and even longer in plastic and metal. This means that everyday actions like holding a rail on the bus could put us at risk of contracting the virus. So, what can you do to prevent the infection? The first thing that you can do is washing your hands frequently with soap and water for at least 20 seconds. A lot of people have recommended for you to sing happy birthday twice because that counts for more or less 20 seconds. If you don't have access to water or soap, you can use hand sanitizer, alcohol, or any solution containing more than 60% of alcohol. Another way is by not touching your face. Avoid touching your eyes, nose, or mouth, especially with unwashed hands. And cover your mouth and nose with your bent elbows like this, or tissue when you cough or sneeze. Another way is by staying home and avoiding crowds. When you go out, stay at a physical distance from other people. Avoid crowds and try to limit your physical contact as much as possible. It is also important to keep informed and follow public health guidelines. Try to stay away from hospitals and clinics unless you need to seek care urgently. Stay informed on the latest developments of COVID 19 and follow the advice given by your national and local public health authority. Follow local guidelines, but where there are shortages of masks, the most important groups to wear masks are health workers, caretakers, and individuals with symptoms who are sneezing and coughing. Masks are effective only when used properly and in combination with frequent hand cleaning with alcohol-based hand rub or soap and water. So, the next and most important question is COVID 19 dangerous? The good news is that most COVID 19 cases are mild. Some people may have no symptoms at all. Some people are more at risk of getting very ill than others. These include older people, people who have weaker immune system, and those with pre-existing medical conditions. So, in short, everyone actually, including young people like us, must work together to contain the spread and protect yourself and those who are most at risk. So, why is it important to stop the spread of the virus? Let me explain why it is important for all of us to stop the spread of the virus. Health systems have a maximum capacity of sick people that they can treat. If we can slow down or stop the spread of the virus, we can decrease the number of people who get sick and need treatment and care at the same time. This means less stressed healthcare system, fewer hospitals visits per day, fewer deaths, and fewer sick people being turned away.